Nigel Deekes, 49 years old, just coming up 50 next year, so the big one, which will be quite interesting because of my illness and where I could have been at being 50 years old against where I am going to be. Diagnosed when I was 45, feeling very fit and well, no idea at all that I was ill. Playing squash actively 3 times a week. Had noticed some weight loss, but that was a Brucey bonus. Diagnosed by flashing in my eye. And I'd had detached retina about 15 years previously. So I thought, well, I better go to the hospital because there was a good chance that I'd done something to my eye again. Went up to the Birmingham Eye Clinic and went in, saw somebody, did what I felt was a cursory blood test, and had a phone call back a couple of hours later saying, get up to the hospital in the morning. So went in with thought detached retina, following morning diagnosed with chronic myeloid leukemia. Taken in first appointment, 9 o'clock, sat down, and they told me pretty well outright, we think you've got chronic myeloid leukemia, which came from a very high white blood count. I was around 145, my count, against the normal count, which would be between 3 and 10. I didn't get upset, didn't do this, that and the other, just spent about an hour talking about treatments that were out there. The first night, very, very upset. You want to see your children grow up. You want to walk your daughter down the aisle. You want to be there. They're 12 and 15. You think, are they going to remember you if you die? And I remember the first night sort of waking up, 3 in the morning and, being very upset. Who wouldn't be in those circumstances? I spoke to a couple of people at Leukaemia CARE, first of all. I wasn't sure whether the treatment I was receiving over that first 3-4 months I'd made the right decision either. But that's how my relationship with Leukaemia CARE came in, and the support and help they gave me. If I go back to the first day I was diagnosed and lying in bed and actually thinking, thank God I got it, because it's easier as the patient to have leukemia than it is as the family or the carer or the wife or the children, because you would take that leukemia from your children in a moment. I decided to set up a group on Facebook, which is CML UK, which is a UK-based CML support group, because a lot of the information is almost too formal out there, and I felt that there was something needed to be able to for people to be able to speak informally, to just chat about how they feel that day, about leg pain, about the drugs, about side effects of the drugs, through the management of Leukaemia CARE and all the staff there that I've dealt with. They've been outstanding in the help they've given me, both as a patient and in my ability to set up the group. Predominantly, I find the most benefit is when people are scared witless, as I was in those first few days, weeks, etc., where you just think, I'm going to die, I'm going to leave my family, I'm going to leave my children, etc. And I think the ability to go on there and say, I'm new, what's happening, am I going to be okay? And for hundreds of people to come back and say, actually, yeah, you are. For the vast majority of patients, life will go on very, very well. You will live a normal life, you will see your children grow up.